And I now have the honor to introduce our next group. We're going to be providing colleagues at the CDC our Maternal Mental Health Hero Award. So let me invite them to the main stage to join me. And I'm going to start by introducing my colleague, Julie Goldstein-Grummett, Dr. Julie Goldstein-Grummett. She's the Vice President and Director of the Zero Suicide Institute and Education Development Center, which is a federally funded program. She's an expert in behavioral health transformation, state and local community suicide prevention, and the use of evidence-based practices for suicide care and clinical settings. I'll also introduce our colleagues now from the CDC before I turn it back to Dr. Goldstein-Grummett. I'd like to welcome Sarah Foster to the stage, who's become a dear colleague. She is the Associate Director for Policy and Partnerships and Communication for the Centers for Disease Control and Prevention at the Division of Reproductive Health, and has been a fantastic colleague and friend to the field. And also Dr. David Goodman, the team leader for the maternal mortality prevention team at the CDC in the Division of Reproductive Health. And then finally, I want to introduce Susanna Trost, an epidemiologist who, those of you who have joined us before for our maternal suicide webinars over the years know Susanna well. She works on the maternal mortality prevention team, supporting maternal mortality review committees in the identification of pregnancy-related and pregnancy-associated deaths, and contributes to the analysis and dissemination of this important data. As Mary Bonahan, a prior speaker today, shared, she was so inspired to do more with her Native American neighbors after attending a 2020 Mom webinar on maternal suicide after hearing Susanna present. So the domino effect is really happening, and we are so grateful for your leadership. Would like to now turn it back to my colleague, Dr. Julie Goldstein-Grummett from the Zero Suicide Institute, to make some remarks before we honor the CDC. Julie.
Thank you so much, Joy. It's been my pleasure to support 2020 Mom and the tremendous leaders they have convened in their efforts to raise awareness and to think about preventing maternal suicide. Our work with the Zero Suicide Initiative focuses on transforming all healthcare systems to ensure that any door is the right door and any provider is prepared to recognize and respond to a person at risk of suicide. We know that access to accurate and timely data is really critical to ensure that training and intervention efforts are targeted appropriately. We're grateful to the CDC's commitment to suicide prevention and are thrilled to recognize you today for the work you're doing to ensure that states are tracking maternal suicides in the US so that we know where to target our intervention efforts and how well we're succeeding. This will transform care, and ultimately it will save lives. So congratulations.
Thank you so much, Julie. And a few more remarks from me before we turn it over to our colleagues at the CDC. I wanted to share that it's been since 2018. I was looking back at my notes in preparation for today's award presentation that we've been working with our partners at the CDC. And if you look back on our website, you'll see a blog post from 2018, later in 2018, that said we're not measuring what we treasure, and we're not measuring yet suicide in the maternal population. And since then, the CDC has made remarkable strides, unpacking new ways to attempt to account maternal suicides, which is very difficult, doing that from the death certificate records, which was what we had previous to maternal mortality review committees diving into this data. And it's just been a tremendous partnership and really incredible work by this division. We are truly grateful for your work in elevating maternal health and maternal suicide in the US, and also grateful for your work in elevating maternal overdose, which together combined with suicide accounts for the largest reason for pregnancy-related maternal death in the United States. With that, I am truly honored on behalf of the maternal mental health field and those working in suicide prevention to honor the CDC's Division of Reproductive Health and these amazing leaders for their commitment and years of hard work promoting the need to gather state data on maternal suicide and begin reporting this important data nationally. And with that, congratulations on being the 2023 Mental Health Heroes. I'll turn it over to each of you. Thank you.
Thank you, Joy. And I want to just share the award here. So thank you very much for this recognition and for all of the work that you do to ensure robust research, policies, and practices to address maternal mental health. Maternal mental health conditions are an important contributor to pregnancy-related mortality in the United States and to overall well-being for pregnant and postpartum people. Recent analyses of 2017 to 2019 data from maternal mortality review committees in 36 US states found mental health conditions to be the most frequent underlying cause of pregnancy-related death. This includes deaths to suicide, unintentional or unknown intent overdoses and poisonings related to substance use disorder, and other deaths determined by the MMRCs to be related to a mental health condition, including substance use disorder. Among the pregnancy-related deaths where an MMRC made a suicide manner of death determination, 8% of pregnancy-related deaths were determined to be a suicide. We appreciate your continued support and interest in this data and your work to ensure that it informs action. We know there is still work to do to improve maternal mental health and eliminate preventable maternal mortality. We are committed to continuing our work to track pregnancy-related deaths with mental health conditions as an underlying cause of death, including pregnancy-related suicide deaths, and to ensure consistent approaches for identifying and reviewing these deaths across maternal mortality review committees. We are currently working with partners at the University of Utah to finalize and publish a set of criteria for guiding MMRCs in determining if a suicide or unintentional overdose death was pregnancy-related, based on input from 58 multidisciplinary participants representing 48 maternal mortality review committees. Everyone has a role in equitably addressing maternal mortality, including communities, health facilities, systems of care, providers, and families. We are committed to moving maternal mortality review committee data to action in order to prevent pregnancy-related deaths and ensure the best possible birth outcomes. This includes engagement with perinatal quality collaboratives, many of which are implementing initiatives focused on improving maternal mental health screening and treatment, and partnerships with community-based organizations. Thank you again for this recognition and for your continued partnership.
Thank you all so much. And join me in giving our group here from the CDC a round of applause. You can't see everyone else's cameras, but in the chat, hopefully you can see some comments. We're just truly grateful for the partnership and the ongoing work. Our Perinatal Quality Collaborative and community-based organization leaders in the maternal mental health space are with us at the forum as well. And there'll be a breakout session for perinatal quality collaboratives to go deeper in this space, and also some great conversations with community-based organizations. Just thank you again for your leadership and deep commitment to maternal mental health preventing suicide. Thank you.